Hello, everyone, and welcome to Acupressure Wednesday. I'm Alexa Hulsey from Encircle Acupuncture in Nashville. Thank you for joining us. So glad you're here today, and we have a guest joining us today as well, Shannon Lawrence, who is an acupuncturist in Los Angeles. And Shannon and I are going to be talking about anxiety today, and specifically social and pandemic anxiety. So I'm going to get Shannon here in just a minute to join us. Let's see. I forget how to do this. So I think we have to go here to requests. Nope, not there. Let's see. Nope, not there. Yeah, as soon as I figure this out, we'll get Shannon to join us. Invite to join. There we go. Shannon. As soon as she joins this feed, then Shannon can join us. So anyway, today we're talking about social and pandemic anxiety. It's going to be a real interesting topic. So Shannon and I both attended Yosan University in Los Angeles, and that's how we are connected professionally. Shannon is practicing out in Los Angeles, and here she is. I'm going to get her to join us right now. And should be tuning in just a minute. So yeah, Shannon and I both attended Yosan University. Hey, Shannon, how are you?
How are you? Good to see you.
Good to see you. Welcome. Thanks so much for joining me today.
Yeah, thank you for inviting me.
Yeah, absolutely. So Shannon and I are going to talk more about our connection through Yosan University in Los Angeles. We're going to be talking about social anxiety and pandemic anxiety, but let's just get started and start doing a few exercises to get us ready for our practice today, and then we'll jump in and start working on some points. So everybody just take a comfortable seat. You want your feet on the floor, about hip width apart. You want your spine nice and neutral. You can have your lower back supported if that's comfortable. And just take some breaths and just tune into how you're feeling today. I like to close my eyes. You can do whatever comfortable for you. And just take some breaths. And just check in and see how you're feeling today. See if your body is trying to send you any messages. Are there areas of tension anywhere? Are there areas of your body that feel heavy or tired? Do you notice tingling anywhere? How's your energy? Are you holding your muscles tight anywhere without realizing it? I tend to hold tension in my face, and I'm feeling a little bit of that today. And we'll check back in with ourselves at the end of our practice and see if we feel any different. So let's do one more breath. All right. And now we're going to do a gathering exercise. This is to gather some chi from our surroundings, and we'll direct that inward, and we'll use that chi during our session. So this gathering exercise, I'm going to do standing. You can do it standing or seated, whatever's comfortable. I'm going to back up a little bit so you can see. You want, again, feet about hip width apart, whether you're standing or sitting. If you're standing, have a little bend in your knees. And you're going to inhale and raise your arms overhead with your palms facing up. Inhale. And then as you exhale, you're going to lower your palms face down and bring your palms to rest on your lower abdomen. And as you're doing that, let's do that a few times. Inhale. As you're inhaling, you want to imagine gathering some chi from your surroundings. And then as you exhale, you're going to direct that chi here towards your lower dantian, your lower center of energy. I learned this exercise as a first-year acupuncture student at Yosan. Shannon, you might have learned this exercise in the same way. We did it in every Qigong class at Yosan. And it really helps to just center you and get some fresh chi circulating. There's plenty of chi to go around, so just gather in as much as you need. One more. Inhale and exhale. All right. Now we're going to take all that chi that we gathered and we want to direct it to our fingertips. So let's rub our palms together vigorously, get them nice and warm. And imagine all that chi that you just gathered really circulating through your extremities to your fingertips, because we're going to be using our fingertips and our hands in this acupressure session. Okay, so now we're ready. Shannon and I are going to be talking about social and pandemic anxiety, such a relevant topic. So we probably have lots to talk about, Shannon, but let's just jump right in and let's talk about some of our favorite points for anxiety. What are some of yours?
Some of mine, pericardium 6.
Yes.
Part 7. And I actually like to use Shin Men. That would be hard to show today. And then sometimes as well, yin tong, I find are really good.
Yes. I have forgotten I have a big ear chart, which I forgot, but we can try to talk about Shin Men. So let's go through these, the pericardium and heart points on the wrist. So I'm going to hold my wrist up here and I'll let you talk about the point and I'll kind of demonstrate on myself as you're talking about it.
So let's do pericardium 6 first. Pericardium is the organ that surrounds the heart. In Chinese medicine, the pericardium is the envoy. It's the protector of the heart. So the pericardium's job is to protect the heart. And when we have anxiety symptoms or flare-ups, the heart will definitely be affected. So we can use the pericardium channel to actually help calm the mind. A lot of times clients will get nausea, stomach upset. Pericardium also it passes through the stomach organ, so we can use that for that. So pericardium 6, easiest way to locate it is if you take your fingers. This is 3 sun. So in Chinese medicine, we don't measure in centimeters or millimeters or inches. We measure in sun or soon. So this would be 3. You can take your 3 soon, and you can see what Alexis is doing. That would be her 3 soon, and just above her 4th, right where her 4th finger ends, is where pericardium 6 would be, and it sits between the 2 tendons on the arm. If you're familiar with a C-band actually is acupressure on pericardium 6, and a lot of clients will tell me, oh yes, I use C-band for nausea, for motion sickness, for anything like that. So that's pericardium 6.
It's kind of right where my bracelet is too. Mm-hmm. And these 2 tendons, sometimes they're really close together on some people and there's barely any space in between them. And some people have a nice wide space between. I always like needling people with a nice wide space between their tendons. It's a lot easier to needle. But yeah, it's right there. Yeah, C-bands are great. We recommend C-bands for our pregnant patients all the time too. It's really, really helpful for pregnancy. It's interesting, I think, the link between anxiety and nausea, because this is a famous point for nausea. Every acupuncturist uses this point for nausea. It works remarkably well. So that's interesting what you're saying about the pericardium channel affecting the stomach, because we don't always think of nausea as a symptom of anxiety, but it is. And there's a connection there with the pericardium channel. So let's talk about, you said heart 7 is another one you like to use?
Heart 7. Yeah. Generally, so traditionally in Chinese medicine, the heart channel was never needled. The idea is that the heart is the emperor, and emperors sit on their thrones. Emperors are supposed to oversee. They don't actually work. Their work is overseeing, I should say. So the whole idea in terms of the heart channel was that we never needled it because it would disrupt the heart and throw the emperor off of its throne. Nowadays, more modern acupuncture, most countries now will needle the heart channel. So heart 7 is just below. It's right at. It's like right below. It's actually right on the wrist just below. It would be, yeah, just below the wrist line. And right here we have, you can see where Alexis is pointing. We have, this is the ulnar bone. This is the radius. So we have the tendon that is here. So you have the bone and then the tendon. The acupuncture point itself is going to sit to the center of the hand or the wrist, which would actually be medial or radial to the ulnar bone.
Yeah, so it's not way over here on the side.
Yeah.
It's a little more inside. Mm-hmm.
And this is really good for any kind of heart palpitations. If you just feel that fluttering or thuddering, or maybe you just feel your heart racing and you just feel like you need to calm down, this works really well to help soothe, basically to soothe the heart.
Yeah. Do you ever use Lungnine with these 2 points and make Buddha's triangle?
Yes, that's one of my favorite point combinations.
Is it? Yeah, I love that point combination. So Lungnine is kind of similar to where Heart 7 is, but it's just on the radial side. And it's also on this wrist crease. And so the 3 points, Heart 7, Pericardium 6, and Lungnine make a triangle, and that is called Buddha's triangle. Do you know why it's called Buddha's triangle, Shannon? I've never learned why. I just always have heard that it's called that, but
I don't know why.
Yeah.
No, I just learned that it was called Buddha's triangle.
Yeah. I like this too because Lungnine is the point for the vessels. It's the master point of the vessels. So I love this one for heart palpitations because it helps to relax those vessels when it feels like your heart's pounding out of your chest. I love to do this combination, especially for palpitations. And I've used this Lungnine as well for just arrhythmias or just anytime it feels like your heartbeat is irregular. That often adds to anxiety because then you start worrying about your heart. So this is a great combination to do with needles or with pressure. Yeah, I love that one. So you mentioned yin tong also. So let's talk about yin tong.
So yin tong it sits between the eyebrows. It's the mid space between the eyebrows. And you'll see Alexis is pointing to it. A lot of times you'll hear it referred to as the third eye. This is a lot of times where, especially when we have an anxiety flare-up, we'll take the stress and hold it. A lot of times you'll squint, or it's just like, I have to like release this. And by needling or putting acupressure on this point, we can actually release the energy, all the yang energy that's in the head that needs to actually descend back down to the body or through the body to anchor ourselves back down to the earth or the ground.
Mm-hmm. I have a patient who calls this point the toilet flush point, not in the sense that it like of flushing the toilet, but she just feels like it just flushes all the toxicity, all the waste products, everything out of her system that she doesn't need. She feels like this point helps her body just to release all of that. So she's always like, don't forget to do the toilet flushing point. But I like that thinking of it just helps your body get rid of what you don't need. And especially emotionally, I feel like it has that effect.
Yes.
Yeah. And then you also mentioned ear Shin Men. I'll try to show you. We've talked about ear Shin Men on here before because it's such a great point, but it's in this triangular depression up here at the top. And you can I sometimes just stick my whole finger because your whole fingertip can kind of fit in there. And you're going to hit some other points too. Yeah. Now, do you use ear seeds, Shannon?
Sometimes I find it depends on the type of anxiety the client has been diagnosed with, because sometimes they will actually pick at them. Which
Oh,
creates more
yeah.
anxiety. So sometimes I will give them ear seeds. Other times I will needle with e-stim.
Oh, uh-huh. Cool.
So it really just depends on each individual. Uh,
Yeah. Yeah. Now, so as I was mentioning at the beginning of this, Chin, you and I both attended Yosan University in Los Angeles, and you are a current faculty member at Yosan, and you practice in Los Angeles at two locations, right? You practice at a couple of different offices,
correct.
and you're a faculty member at Yosan, and you are finishing up your doctorate at Yosan, and you're going to be
Yes.
done like next week. Is that right?
April
Very soon?
18th.
April
Very
8th. Congratulations.
Thank you. Thank you.
So yeah, busy woman teaching, pursuing a doctorate, practicing. That's awesome. And something else that we have in common is that we have taught the same class. Actually, I was a faculty member at Yosan a number of years ago, and I taught the Introduction to Meridians course, which you teach now. And I always loved teaching that class, working with first-year students and helping people just really start to understand how to feel chi and how to locate points. And so a lot of our viewers, well, most of our viewers aren't acupuncturists, and so they often have questions about how to know if they're in the right spot. So when you're working with new students, how do you help people really feel the chi and locate the meridians and locate the points?
Um, Lots of practice.
Yeah.
Lots of practice. One of the things I always I tell the students that the it will always feel different for everybody because we all have our own chi, and then whoever you're working on has their own chi as well. But palpation, just literally getting your hands on someone and just really pressing and feeling like, what does the lung channel feel like? What does
Mm-hmm.
it feel like on yourself? And then what does it feel like on someone else? What
Mm-hmm.
does the small intestine channel feel like?
Mm-hmm.
Are there any like nodules there? Is it tight, or is it more like loose and supple? Uh, and then I always remind the students to, because I'm sure with Intro to Meridians that sometimes it becomes very academic, like they're just
Mm-hmm.
so stuck in the book, and I just always remind them that Chinese medicine is an art.
Mm-hmm.
It's a medicine that's an art, and it's all about your hands, and it's all about touch,
Mm-hmm.
and cultivating your energy, meditation, chi cultivation, and also taking care of yourself. Like what you put into your body is really important
Mm-hmm.
because that will affect how you're actually feeling on the client or the patient.
Mm-hmm. Yeah. I think sometimes it's good to let our brains kind of get out of the way and not worry so much about being on exactly the right point, and just really try to feel and sense what the body is telling us. And I don't know if you can see on here, but where I was pressing on
Mhm.
heart 7, it's still a little red, and that was a few minutes ago. So we get visual cues from the body as well. And I like to pay attention to those. So if you're doing acupressure on yourself or on someone else, pay attention to the visual cues. So my heart 7 is really reactive today. And it is on this side too. Not as much. Lungnine looks okay. Pericardium 6 looks okay. But heart 7 is, it's like it's trying to tell me something. For me, that might mean I have a little more anxiety than normal, or maybe I need to pay attention to sleep. Last night, I didn't get as much sleep as I usually do. I like to get my full 8 hours, and I did not get that last night. So that could be a reason why my heart channel is a little irritable today. Um, I, uh, I remember one time I was treating a patient. I was a very new practitioner, and I was still learning some of these things. And I was treating a patient for some respiratory issues, and he was just lying there on the table. And there's a point right here,
Mhm.
REN 22, and this point on him was very red. It was like screaming at me. And I hadn't needled this point. I had needled some other points, but this point was just like, rah, rah. And so I needled that point on him. And this patient, he'd had a lot of acupuncture. He was like an acupuncture pro. So I needled this point on him, and he said, "Oh, I love that point." And it was so cool because he didn't have to tell me that with his words, but his chi was telling me that. So the body's going to give us signals, and I like to think of acupressure as a feedback loop. You send a message to the body, and then you get something in response to that. Yeah.
Absolutely.
So one of my favorite points for anxiety is do 20.
Yes.
And do 20, yeah, right there at the top of the head. So it's really just at the apex. And yeah, Shannon's showing you the textbook way to find this point is to fold your ear forward. And then the tip of your ear is going to point to do 20 at the top of your head. And yeah, you just trace a line up there, and there's do 20 at the top of your head. I think that this is a great one to practice with when you're trying to feel it on yourself, because you can usually feel when you're in the right spot. So if you're a little off center, you can usually tell on yourself. And like sometimes I'll have patients say to me, if I needle that point on them, I'll sometimes have patients say, "Oh, that's not the right spot. You got to do that again." Because they know you can pretty much tell where the center of the top of your head is. So that's a good one to practice on when you're trying to figure all this stuff out for yourself. I like do 20 because it really regulates the upward and downward flow of chi in your body. It's called 100 meetings. All of the points meet there, or all of the yang channels meet up there at the top of the head. So we're talking about anxiety today, and I shared this with you, Shannon. I found a statistic the other day that says 1 in 4 Americans have experienced anxiety during the pandemic. To me, that seems low. I feel like way more than 1 in 4 people are experiencing anxiety.
I feel like it's like 9 out of 10.
Yeah,
or like 8 out of 10.
I agree. I mean, there's a lot to be anxious about. So I feel like pretty much everyone is experiencing this on some level. Maybe if they're not having the heart palpitations or the insomnia, but they're feeling some level of unease. So what's some other advice that you have for patients when they want to help to get their anxiety a little more manageable? Do you have any sort of tips that you give people?
Usually I'll ask them, like, when do you get anxious? What are you doing when it actually comes on? What are you thinking about? Write it down in a notebook. Keep track and see if it's the same things over and over again. And then once they're able to figure that out, usually, as long as it's like within like our scope of practice as an acupuncturist, I'll have them start trying to eliminate either, maybe it's a certain individual, or maybe it's a certain type of event, or maybe it's a family issue, and really trying to help the client find separation in what is causing that. Other things, it's just like, if you feel like you need to lay down and take a nap, just do that. Remember, you're in control of your body. Nobody else is. We live in a society that's really based on like hustle and bustle. And it's a lot of times it's not really about us being healthy, especially with work and other things. And I always just like to give that reminder that we're in charge of ourselves. It's okay to call out of work. It's okay to not go meet up with your friends. It's okay to stay at home and watch a movie. That's when you're doing that, you're healing yourself.
Yeah. And I think especially this year, as people have had to make so many different arrangements in their lives, their kids have been home doing school from home. People have been working from home. People have been laid off. And they're just navigating all this newness. And, sometimes even just getting through the day without without being just totally stressed out and anxious by the end of the day is really challenging, because you have you know, the stress of the pandemic, but it's also just figuring out how to live your life in this new way that we're not used to, and and being in new spaces, and home offices, and kids at home, and spouses at home, and you know, not seeing family and friends. It all adds up and takes a toll.
Yes. Yeah.
So self-care is really important.
Yes.
Well, before we get into our closing check-in, any final thoughts that you want to add, Shannon, or other insights that you have about anxiety?
I think it's really important to remember that if you're feeling this, like, you're not alone. Sometimes I feel like people feel they are alone going through this, but there's so many people who are dealing with either social or pandemic anxiety right now, myself included. I will say I have generalized anxiety disorder.
Myself too, yes.
And I used to think that I was alone and I was the only person who dealt with it, even as a practitioner. And so just know there's lots of resources out there to help you, whether it's acupuncture, acupressure, any form of Chinese medicine, therapy, diet, exercise. There's plenty of resources. So never feel alone, and always reach out. Again, reach out to your Chinese medicine providers if you're getting Chinese medicine, because we're trained in, this is what we're trained in, and we're here to help you get better.
Yeah, absolutely. And so many people deal with anxiety. It feels very isolating, but if you are struggling with anxiety, just know that you are in good company, because lots of other people are dealing with it as well. And it helps to just talk about it and talk about how it affects you. So, yeah. All right, well, let's check back in with our bodies now that we've done some acupressure. So we'll sit back again, feet on the floor about hip width apart, spine nice and neutral. And let's just take some breaths. I'm going to close my eyes again and just see how you're feeling. So I'm still feeling a little tension in my face. So I probably need to spend some more time doing yin tong. I know that will help. Let's take one more breath. All right. Well, thank you everyone for joining us today. Thank you so much to Shannon. This has been such an interesting conversation. We're going to put links to all of Shannon's information in the notes for today, in case you want to learn more about Shannon and her practice. This was fascinating. Thank you so much, Shannon. This was really great.
Thank you. Thank you for having me. I appreciate it.
Absolutely. And thank you for joining us, everyone. Have a great day, and we'll see you next time. Bye. Thanks.